Meanwhile, the renowned Cleveland Clinic says it has not yet been impacted by the new health care law. Joining us now to talk more about how he's preparing for the Affordable Care Act, we're happy to have with us Dr. Toby Cosgrove. He's president and CEO of the Cleveland Clinic. Toby, so nice to have you back on the program.
Nice to be with you, Susie.
So there's more people are going to have access to our healthcare system, but the big worry is, what is it going to do to costs? And what does it do to costs for the Cleveland Clinic?
Well, we know, and we have known this for several years, that we have to reduce the cost of health care, not just for the Cleveland Clinic, but really across the country. We look at it really as a patriotic duty to take down the cost of health care because it's beginning to jeopardize things like education that are important. So we have been working hard to reduce our cost, and we've done several things. For example, over the last couple of years, we've taken $180 million out of our purchasing. We've consolidated services that made them higher quality and lower cost and more efficient. But all of that still means that we're going to be paid less by our private insurers. We're going to be paid less by Medicare for what we do. And we still don't have Medicaid extension in the state of Ohio. And we're concerned that we need to take our costs down still further. So we have need to take out about $330 million out of cost for next year.
And you warned, Dr. Cosgrove, that that might include layoffs at the Cleveland clinics. I'm curious, where one of the largest, most respected hospitals in the country, when you cut $300 million out of your budget, where does that come from?
Well, ultimately, we realize that 60% of our costs are related to salaries and benefits. And we're probably going to need to reduce our force ultimately. And we're looking at early retirement. We've offered that to about 3,000 people across our organization. And we'll have to wait and see how that does at reducing our total cost of personnel.
And so this raises questions for a lot of Americans, like what does all of this mean for the quality of health care if that's what the Cleveland Clinic is doing? And we're seeing that a number of hospital systems are merging, and Cleveland Clinic has made some acquisitions in the past. Are you going to be doing more acquisitions? And what does all of this mean for the quality of health care?
Well, we think that one of the ways to make the healthcare system more efficient is by consolidating hospitals and caregivers. And we now see 60% of the hospitals across the United States are part of a system. And that allows us to take costs out of the back end of the healthcare delivery system. It's a little bit like mom and pop stores have gone away over time, and we now see supermarkets. The costs are lower and the quality is better as you begin to consolidate and take those inefficiencies out of the organization.
Are you convinced that the Affordable Care Act will eventually lead to lower premiums, lower costs for people buying health insurance? One CEO of a major health insurance company told me they're going to leave those states where they can't raise premiums enough. In other words, where their profit margins are not going to be enough. So they will go to those states where they can have a high enough profit margin that it makes sense doing business in that state, which says to me they're looking for higher premiums, not lower premiums.
Well, what we're really seeing is the government has expected that healthcare costs are going to go up next year. As you know, the rate of inflation in healthcare has been coming down over the last several years, and it was 3.6 last year. Government is expecting it's going to go up to somewhere about 6% next year, and that's because you've got a lot more people coming into the system. But I don't think we can tell yet, exactly what's going to happen to costs because we really don't know on several things that could affect it. First of all, we know that the population is getting older. We know we have more chronic disease. We similarly for that. So we're going to have to wait and see the results of this reorganization of healthcare across the country. It's an experiment that hasn't been done before, and we know we have to change. We're going to change, and we'll see how it turns out.
Real quickly, we just have a few seconds left. We're seeing a lot of new players get into this. You say it's an experiment. Yeah. We're seeing Walgreens, we're seeing CVS having these walk-in clinics. Real quickly, is this a good thing?
Well, what we're seeing is a change in primary care, and I think primary care is going to be more and more taken up by physician's assistants and nurse clinicians. And the reason for that is there's about a 45,000 doctor shortage of primary care physicians across the United States. And so those organizations are beginning to fill a gap. And I think at the end of the day, you'll see physicians practicing at the top of their profession.
A lot of dramatic changes. Thank you so much. Toby Cosgrove, President and CEO at the Cleveland Clinic.
My pleasure.